Hello, and thank you for tuning into this annual Notice of Change video. My name is Renee Bellinger, and I'm a licensed agent and Medicare expert here at Blue Cross and Blue Shield of Minnesota at the Roseville Center. First, I want to thank you for being a Blue Cross member. We appreciate your business and truly value your membership, your health, and well-being. As a reminder, the annual election period runs from October 15th to December 7th. This is your time to review your coverage and make sure it's still a good fit for you. If it is, you don't have to do anything. Your plan will automatically renew and continue through the next year. However, if you have questions or want to make a change and enroll into a different plan for 2022, please call or visit our website to set up an appointment. One of our agents will be happy to review this information with you one-on-one. We're available for appointments in person, over the phone, or video call. So don't hesitate to reach out. All right, let's get started.
All right, well, today we are again going to be focusing on the plans as they will look next year in 2022. The agenda for today, the topics we're going to be covering, we are going to spend just a few moments talking about Medicare basics. So here we're going to talk about Part A Medicare that covers you when you're in the hospital, and Part B is in Bravo Medicare that covers all the things you do outside the hospital. In Part A and Part B together are commonly referred to as original Medicare. And I want you to think of that as the base coverage that everyone in the country starts out with. So that's what you're getting from the government. And we'll just spend a few moments again reviewing Medicare basics. And then we'll move in and really spend the majority of our time today talking about the Blue Cross Blue Shield plans that supplement, that give you more coverage than what you're getting from that Part A and Part B original Medicare. And we'll talk about our extra supplemental plans in this order. We'll start by reviewing our Advantage plans. Then we'll talk about our cost plans. Next, we'll move into our Medicare supplements. And we'll finish today by talking about our Part D drug plans. Well, key enrollment periods. So the initial enrollment period is going to be important for folks that are going to be new to Medicare because they're turning 65 in the near future. The initial enrollment period includes the month you turn 65, the 3 months before, and the 3 months after. So it is a 7-month window. And again, this is applicable for folks that are going to be turning 65 in the near future. Next, we have special enrollment periods, and there's a number of different events that may occur in your life that will open up a window of opportunity for you to either sign up for Medicare for the first time or in some cases make changes to whatever extra supplemental coverage you currently have. The most common special enrollment period that I see would be folks who turn 65, so they are indeed eligible for Medicare. However, they're working and their employer offers a health plan and they want to stay on that employer-sponsored plan. Well, you can do that and put off Medicare as long as your employer is offering what's called creditable coverage. Now, creditable just means as good or better than what Medicare offers. To find out if your employer offers creditable coverage, you can talk to someone in HR or whoever handles benefit administration at your company. As long as it is creditable, stay working, stay on that employer plan as long as you like. When you retire, that is the special enrollment event because now you're not eligible to stay on that employer-sponsored health plan. Now you can move in to Medicare. To the lower left, we have the annual election period, which is probably why the majority of you are tuning in today. The annual election period runs between October 15th and December 7th. And this is the time of year when all people on Medicare can review their current coverage and determine if it will continue to be suitable moving into the following year. Now, if you decide you want to keep the plan you have this year for next year, there's nothing you need to do. That plan will automatically renew and continue through 2022. However, if you want to choose a new plan for next year, you're simply going to submit an application to Blue Cross Blue Shield between October 15th and December 7th. And whatever new plan you elect during that period, it will then take effect January 1st of next year. And then over to the right, we have what's called the open enrollment period. Now, this period is only going to pertain to those Medicare beneficiaries who have elected what's called an Advantage plan. And an Advantage plan is just a type of plan insurance companies offer that gives you more coverage than what you're getting with that base, original Part A and Part B Medicare. We'll go into far more detail about our Advantage plans, but for now, just know if you've elected an Advantage plan and during the first 3 months of the year, you decide that plan's not working for you. Maybe the benefit structure just isn't working how you thought it would, or maybe your needs have changed. You actually get an opportunity to drop that Advantage plan and pick up something else. So it very much works like a trial period for those folks who have an Advantage plan. All right, well, let's talk about original Part A and Part B Medicare. And you'll notice on this slide at the top, it says 2021. And that's because Medicare has not yet released the 2022 updates. That should be available sometime mid to late October. And you can get those updates by going onto Medicare's website at medicare.gov, or you can certainly call your agent or Blue Cross. So Part A Medicare is there to cover you while you're in the hospital. And Medicare breaks this benefit into 3 different periods. The first period is going to cover the first 60 days that you're in the hospital. For those 60 days, you have a $1,484 deductible. So you pay the hospital the first $1,484 for covered benefits. Then Medicare steps in and they pay 100% of the cost for your covered benefits during that 60-day window. Now, the next period gives you 30 more days of coverage, those being days 61 through 90. Now, instead of a deductible, you have a daily copay, and that's going to be $371 every day. The next period gives you 60 more days. Those would be days 91 through 150. And now you still have that daily copay, but it doubles from what it was during the last period. It goes up to $742 every day. And you'll notice in parentheses, those last 60 days, days 91 through 150, are referred to as lifetime reserve days. And that means kind of like what it sounds like. You only get to use those last 60 days one time in your life. If you start dipping into those days and using them, you do not get them back. So you really want to think of this Part A benefit as 90 days of inpatient hospital coverage per benefit period with an additional 60 lifetime reserve days to use should you need them. Okay, let's talk about Part B as in Bravo Medicare. That's going to cover all the services you get outside the hospital. So this might be things like office visits to a primary care physician or to a specialist. This could be diagnostic testing like x-rays, MRIs, CT scans, durable medical equipment like canes, walkers, wheelchairs, CPAP machines. This could also be an ambulance ride or a trip to the emergency room. So quite a few things are covered under this Part B umbrella. Now, in 2021, the monthly cost for Part B starts at $148.50 a month, but it can go up to just over $504 a month. Now, what you pay every month to the government to have that Part B as in Bravo depends on your income. Quite simply, the more money you make, the more you're going to pay every month for that Part B benefit. Now, there's also a deductible for your Part B benefits. It's $203 for the year. So you're responsible for the first $203 and any covered outpatient benefit cost. Once you meet that deductible, it turns into an 80-20 plan, meaning Medicare pays 80% and you're left paying the remaining 20%. Now, just as important as it is for you to understand what Medicare, Part A and Part B, that original Medicare benefit does cover, it's also very important you understand what Medicare does not cover. So the first bullet point, we've really got into this, inpatient hospital days beyond Medicare's limits. Well, we know now you get those 90 days of inpatient hospital coverage per benefit period and those extra lifetime reserve days to use should you need them. But if you exceed those limits, then you don't have any coverage if you just have this original Medicare. Routine physicals. So how this works is Medicare gives you 12 months from whenever your Part B is in Bravo starts to go get what's called a Welcome to Medicare exam. And this is a fairly thorough annual physical, but Medicare will only cover that one time in your life. All right, so after that first year you're on Medicare, you get what's called a wellness visit or a wellness check. And this one is pretty limited in scope. In fact, it doesn't do much more beyond your height, your weight, and your blood pressure. Now, Medicare will cover some bigger ticket preventive services, such as mammograms and colonoscopies. But that actual office visit to go in and visit with your doctor is going to be limited by the scope of the wellness visit. Some other preventive services Medicare simply will not cover: a routine hearing exam, a routine vision exam, and most of your dental care. Now, Medicare is set up to cover you in the U.S. only. Very rare circumstances where you would see any coverage outside the U.S. And then finally, we talk about prescription drugs not covered by Part A or Part B Medicare. Well, let me first tell you what kind of medications are covered under Part A and Part B. When you are in the hospital, any medication administered to you is going to be covered by Part A. Now, Part B is in Bravo drugs. Medicare decides what those are. All right. Now, most Part B is in Bravo drugs are going to be drugs that need to be administered to you in a clinic or sometimes a hospital setting. Most common example of a Part B is in Bravo drug would be chemo. But most of us get our medications when the doctor writes a prescription and we go to the pharmacy to get that filled. And those kind of medications not going to be covered under A or B. To have that kind of coverage, you're going to need to add a Part D drug plan. Although Medicare does make the rules on how these drug plans work, they're always going to be administered by insurance companies like Blue Cross. And we'll certainly spend time today talking about our drug coverage. Last thing I want to mention about original Medicare before we do indeed move in to those Blue Cross Blue Shield supplemental plans is up at the top of the screen, just to the right of the $sign where it says original Medicare does not have an annual out-of-pocket max. And that simply means if you exceed the number of inpatient hospital days Medicare covers, you're on your own and there's no limit to what your bills can be. Services you get outside of the hospital, we know now that you're roughly paying 20% of the cost for those outpatient services. The big question here would be 20% of what cost, right? Some of your primary care physician visits might not be too expensive, but you start seeing specialists. You start getting some MRIs, CT scans, you take an ambulance ride or need some emergency care. That can be very expensive, paying 20% of which can still be a very high number. And again, with just original Medicare, you have no limit to what you're going to be paying. Now, this is without a doubt the number one reason why people will look at and add supplemental coverage. All right, well, a little bit of background about Blue Cross before we do dig in and get into more detail on our supplemental plans. We have been in Minnesota for 85 years. That does make us the longest running health insurance company in the state of Minnesota. We currently have over 320,000 Medicare members. Now, that number represents over half of all eligible Medicare beneficiaries in the state. And one of the reasons we have so many members is because year-round we have a lot of employees at Blue Cross that work very hard to develop highly rated Medicare plans. We're also very committed to giving back to our local charitable organizations. So again, just a little background about Blue Cross Blue Shield. All right, well, let's start talking about our Advantage plans. Now, the first thing you need to know about our Advantage plans is that they are regional. And that simply means the county you live in is going to determine which Advantage plans you are actually eligible to enroll in. And in Minnesota, we have 3 different regions, and we will be talking about them in this order. We have our Metro region, our West region, and finally our South region. So we'll start with the Metro region, and I want to direct your attention first to the right of your screen, those 2 maps of Minnesota. That map on top in blue is going to highlight the 9 counties that make up the Metro region. So you do need to reside in one of those highlighted 9 counties in order to be eligible to enroll in the Metro Advantage plans. However, if you look to that map right below, you'll notice the network, the doctors that you can go see. That is statewide and is made up of about 96% of all providers in Minnesota. So Allina, Abbott Hospital, Park Nicollet, Health Partners, M Health, Fairview, University of Minnesota, Centricare, the Mayo Clinic, Sanford, St. Luke's. Those are all examples of providers in the network. Again, statewide, 96% included. Now, these Metro Advantage plans have low monthly premiums. In fact, we have a plan that is at no cost. There's three altogether, three Metro Advantage plan options, all of which are going to include not only medical, but also Part D drug coverage and a lot of nice extras like dental, vision, and hearing. Again, we do have that huge statewide network. If you do travel outside of Minnesota, but within the U.S., we extend coverage to all 50 states. And if you leave the U.S. and do some international travel, your emergency coverage is going to go with you. Now, these are annual contracts, which simply means year to year, there can be some changes. And speaking of changes, we will be making some nice enhancements to our Metro Advantage plans moving into next year. First of all, the monthly premium on our choice plan will be going down. On both our core and choice options, the out-of-pocket exposure is going to be going down. And again, on our core and choice plans, the deductible for medications, that will also be going down for 2022. So great changes right off the bat. Now, a lot of members have been asking us to add more comprehensive dental coverage. We've heard you. We're going to add that next year for our choice and complete plans, and we will spend some time in just a few slides going through that in more detail. Also, another thing members have really been asking about is moving to a copay structure for our radiology services. So right now, our core and choice plan members are paying a percentage of the cost for radiology services. But next year, we're going to be moving to a set copay structure. So great enhancements, great changes that will be happening on our Metro Advantage plans for next year. All right, well, not really changes to these plans, but these are definitely key features you want to be aware of. One more time, I want to tell you about that huge statewide network, including 96% of all providers. We do have about 63,000 pharmacies that participate in our network across the U.S., and this is going to be really important. There's no referrals needed. So if you want to go see a specialist, or maybe you want to go get a second opinion, you do not need to go to your primary doctor to get a referral. You simply can pick up the phone and make that appointment. So we make it very easy for our members to navigate through that huge statewide network. Now, again, if you travel outside of Minnesota, but within the U.S., we extend coverage to all 50 states, and our members get to travel for 9 months every year. If you do leave the country, your emergency benefit goes with you, although that's a nice benefit to take with you outside the U.S. I do recommend to all my Advantage Plan members, if they're traveling internationally, to look at adding travel insurance. And we've got a great product at Blue Cross called Geo Blue. We won't have time to go into details on how that works. Just know we have that travel insurance, and feel free to contact us. We'd be happy to get you more information on how that works. All right, well, here we have our three Metro Advantage plans, the core, choice, and complete. The core plan will remain a $0 option for next year. The choice plan, we're seeing a slight decrease in the monthly premium. That'll go down to $78.70. And then finally, our complete plan will be at $161.90. All our plans for medical benefits will remain with a $0 deductible. The out-of-pocket max is going to be reduced on the core plan next year by $400. So that's going to go down to $5,500. On our choice plan, we're reducing your out-of-pocket exposure by $100 next year. That'll be at $3,000. And then finally, the complete, that out-of-pocket max is going to be set at $2,900. Now, those out-of-pocket maxes right below where it says in and out of network combined, that would be your out-of-pocket max if you get services outside the network. Now, that would be really hard to do because we cover 96% of the providers. But if you find one of those 4% that do not participate, you still have a network. So there is an out-of-network benefit. It's just not as good as when you stay in the network. And that's why those out-of-pocket maxes are a little higher. Now, speaking of out-of-pocket or out-of-network services, you can see that last line item, what you would pay per service if you go outside the network, it would be either 40 or 45% of the cost. All right, but what if you're in the network? What kind of copays would you be looking at for in network services. And on this slide, we're going to address this. So in the column to the far left, what we've done is identify some of the more commonly utilized medical benefits. And then you can simply slide over to the right to see what copays you would have to take advantage of those benefits. Now, I'm not going to go through all of these benefits, but I do want to highlight some of the nice changes moving into next year. So first of all, the first line item where it talks about specialist visits. On the core plan, we're going to reduce your copay for specialist visits next year by $10. So next year, our core plan members, just a $40 copay to see a specialist. Outpatient x-rays on the core and choice plans. This year, you're paying either 20 or 15% of the cost for those services. But next year, it's just going to be a $10 copay on the core plan, and there will be no cost on the choice. Now, examples of what would be considered an outpatient x-ray. Say you twist your ankle and you go into an orthopedic urgent care to have them take a look at it. The picture, the image they're going to take of your ankle, that's going to be considered an outpatient x-ray. Outpatient advanced imaging. Again, this year our core and choice plan members are paying either 20 or 15% of the cost for those services. But next year, $95 copay on the core, $70 copay on the choice. Now, examples of what would be considered an outpatient advanced imaging benefit, well, that would be like a CT scan, an MRI, ultrasound, PET scan. That would be examples, again, of outpatient advanced imaging. And then we have diagnostic mammograms and colonoscopies, which again, our core and choice plan members this year might be paying 20 or 15% of the cost, but next year, no cost for those services. And finally, we have outpatient diagnostic procedures. Now, examples of outpatient diagnostic procedures would be things like an EKG, pulmonary function tests, neurological testing like an EEG, or sleep studies. So again, this year, core and choice plan members paying 20 or 15% of the cost, but next year, it'll go to a set copay of either $25 or $20. So great changes on our core and choice plan moving into next year on these diagnostic procedures, imaging, and x-rays. Now, over on the complete plan, like this year, next year, all those services I just talked about will be at $0. Another great change, inpatient hospital on our core plan. We're going to reduce that copay to $300, and that would be due for the first 5 days. So $300 per day for the first 5 days of hospitalization. After day 5, no further responsibility on your part. And the choice plan, we are also reducing that inpatient hospital copay. That's going down to $150, and that covers the entire admittance, whether you're there 1 day, 5 days, or 50 days. It's just that one-time $150 copay. Moving into the next slide, we continue with medical benefits, and here, really no significant changes moving from this year into next year. All right, dental benefits. Again, the major change here moving into next year is on the choice and complete plan options, where we will be adding a comprehensive dental benefit. But this year and next year, we're going to continue to cover that preventive dental, meaning you get 2 exams, 2 cleanings, a set of x-rays, and a periodontal cleaning, and that'll apply to all 3 options. A new benefit for next year, fluoride treatments. And again, all of our Advantage Plan members are going to get 2 fluoride treatments covered in full, no cost to you. Now, the remaining benefits listed on this slide, again, will only apply to the choice and complete plans. You can see fillings, extractions, root canals, periodontics, implants, bridges, dentures, crowns. That's all going to be included in your coverage. And you would be paying either 30% of the cost for those fillings or 50% of the cost for any of those other comprehensive dental benefits we just mentioned. So great changes again moving into next year with that dental coverage that's included with that choice and complete plan. Okay, drug coverage. So we will have 5 different tier levels of medication, and you'll notice that listed in the column to the far left. The first two tier levels of medication Tier 1 and 2, those are going to be primarily made up of your generic medications. Tiers 3 and 4, you're getting into primarily brand name medications. And Tier 5, that would be for specialty drugs. Now, on the core plan this year, there's no deductible for just Tier 1 drugs. But next year, we're getting rid of that deductible not only for Tier 1, but also Tier 2. We're also then lowering the deductible next year for medications to $350 for Tiers 3 through 5 medications. On the choice plan this year, no deductible for Tier 1 and 2 meds, but next year, Tier 1, 2, and Tier 3 medications will have no deductible. And the deductible on Tiers 4 and 5 medications is going to be lowered to just $250. On the complete plan, no deductible for any covered medications. And you can see that our insulins on this plan, our covered insulins, will be at no cost for our complete plan members. Also, big change on the choice and complete plans. We got rid of that standard and preferred pharmacy. So now, as long as you use a pharmacy and network, it's going to be the same copay. So no preferred and standard pharmacies on choice and complete for next year. The coverage gap, or what's commonly referred to as the donut hole. Now, this is a Medicare rule. And remember, Medicare comes up with the rules on how these drug plans need to work. And this rule of the coverage gap does apply to every drug plan in the country. And these dollar amounts and percentages I'm about to talk about, again, are set by Medicare. So how this works is once what you have spent on your medication and what Blue Cross Blue Shield has subsidized, when those two numbers together add up to $4,430, you are in the coverage gap, meaning you're going to go to paying 25% of the cost for all covered medication. And you'll keep paying that 25% until what you and you alone have spent on your medication reaches $7,050. When you get to that point, you have reached what's called catastrophic coverage. Now you go to paying $3.95 for covered generics, $9.85 for covered brand name drugs, or 5% of the cost, whichever is greater. And it's according to this schedule that you will continue to pay until the end of the calendar year, at which time the slate is wiped clean and you start over. All right, well, some nice extras that come with our Advantage plans. First of all, the over-the-counter allowance. We're going to give our complete plan members $50 a quarter for over-the-counter items and $40 to our choice and core plan members. Now, examples of what's considered an over-the-counter item, that would be things like vitamins, supplements, could be Band-Aids, bandages, even toothpaste, sunscreen, bug spray. Those are included. So great benefit that we will continue to offer on all our Advantage plans moving into next year. Another benefit that will continue is Silver Sneakers. This is your gym membership. So whatever Blue Cross Blue Shield plan you enroll in, the monthly premium you pay to have that plan is going to cover a gym membership in full as long as that gym participates with Silver Sneakers. And right now, there's over 17,000 participating gyms across the country, and you can join any one of those. Acupuncture going to continue to be covered next year, 20 visits for pain. We will also continue to offer all of our Advantage plan members 2 vision exams, no cost, and we'll continue to offer reimbursements for glasses or contacts. All of our Advantage plan members will continue to get a full, thorough annual physical that goes above and beyond that wellness check that Medicare offers. We will also cover a hearing exam for all our Advantage plan members, no cost, and we will continue to send our members meals after inpatient hospital stays. The big change with dental is on that choice and complete option. We're adding that comprehensive dental coverage. All right, well, let's next talk about the West Region Advantage plans. And again, if you draw your attention over to the right of the screen, you'll notice 2 maps of Minnesota. The map on top in blue is going to highlight the counties that make up the West Region. So you do need to reside in one of those highlighted counties in order to be eligible to enroll in the West Region Advantage plans. However, your network, if you look to the map below, is statewide and made up of 96% of all the providers in Minnesota. So huge statewide network, which is going to include mHealth, Fairview, University of Minnesota, CentraCare, Allina, Park Nicollet, Health Partners, the Mayo Clinic, Sanford, St. Luke's. Those are all going to be participating members in our network. Now, these West Region Advantage plans have low monthly premiums. In fact, one of the plans is at no cost. There are 3 total West Region Advantage plan options, all of which include both medical, drug coverage, and a lot of nice extras like dental, vision, and hearing. Now, again, we have that huge statewide network, but if you travel outside of Minnesota in the U.S., we do extend coverage to all 50 states. And if you travel outside the country, your emergency benefit is going to go with you. These are annual contract plans, which simply means year to year, the benefits can change. Speaking of changes, we're going to have some nice enhancements that we will be offering next year to our West Region Advantage Plan members. First of all, the out-of-pocket exposure on our core and choice plans will be going down. The RX deductible on the core and choice plans also is going to be reduced moving into next year. And your inpatient copay for core and choice plans, that's also going down. Now, a new benefit for next year, and this is one a lot of our members have reached out to us and talked about wanting us to add. We've heard you. We're going to do that for next year. We will be on our choice and complete plan adding comprehensive dental, and we'll get into more detail on what that comprehensive dental looks like. Also, a lot of members have given us feedback that instead of having a percentage of the cost that you pay for radiology services, which you do this year on core and choice, well, next year we're going to move that to a set copay structure. And again, we'll go into more detail about what that looks like. But great enhancements, great changes with these West Region plans moving into 2022. Well, not necessarily changes to these West Region plans, but definitely key features to be aware of. First of all, one more time, want to mention that huge statewide network that is comprised of 96% of all providers in Minnesota. We have about 63,000 pharmacies that are in network across the U.S. And really importantly, no referrals are needed. So if you want to go see a specialist or if you want to just go get a second opinion, you can do that. You just need to pick up the phone and make the appointment. No need to get a referral from your primary doctor. So we do make it very easy and convenient for our members to navigate through that huge statewide network. Now, as I mentioned before, if you travel outside of Minnesota but within the U.S., we extend coverage to all 50 states, and our members get 9 months to travel around the country every year. If you travel outside the U.S., your emergency benefit is going to go with you, which is great. But I do recommend to all my West Region Advantage Plan members, if they're traveling internationally, to consider adding travel insurance. And we have a great product at Blue Cross called Geo Blue. If you're interested in getting more information about how that Geo Blue travel insurance works, please feel free to get in touch with us. All right, well, here we have our 3 West Region Advantage plans. We have the Core, the Choice, and the Complete. The Core plan is a $0 plan, no cost to be a member of the Core plan. The Choice plan next year will be $87.40 a month, and the Complete will be $189.20. No deductible for any medical benefits. The out-of-pocket max on that Core plan next year will be reduced by $400. So that's going down next year to $5,500. The Choice plan, we're reducing that out-of-pocket exposure by $100. That'll go down to just $3,000. And then finally on the Complete, that out-of-pocket max will be at $2,900. Now, the out-of-pocket max is listed right below where it says in and out of network combined would be your out-of-pocket max if you get services outside of our network. Now, that would be hard to do in Minnesota, right? Because we cover 96% of all providers. But if you found one of those 4% that do not participate, you still do indeed have a benefit. It's just not quite as good as when you stay in the network. So that's why those out-of-pocket maxes are a little higher there. Now, speaking of out-of-network services, per service, you would pay either 40 or 45% of the cost, again, for those services that you get out of our network. All right, well, what if you're in the network? What do the copays look like for that? So what we've done on this slide over to the column on the far left is we've listed some of the more commonly utilized medical benefits, and then you can simply slide over to the right to see what kind of copays you would have. I'm not going to go through all of these benefits. I just want to highlight some of the changes moving into next year. So on that first line item, specialist visits, our core plan members are going to see a $10 reduction in their copay for specialist visits. That'll just be $40 next year. X-rays. This year, our core and choice plan members are paying either 20 or 15% of the cost for X-rays. However, next year, our core plan members, just a $10 copay, and our choice plan members, there will be no cost for X-rays. Now, examples of what would fall under this category of X-ray. Let's say you fell down and you hit your knee and you needed to go get it looked at. Maybe you go into an orthopedic urgent care. The image that they're going to take likely going to be considered an X-ray, okay? Outpatient advanced imaging, the next line item. Now, examples of outpatient advanced imaging would be things like CT scans, MRIs, ultrasounds, and PET scans. All right. Now, again, this year, our core and choice plan members are paying either 20 or 15% of the cost for those services. But next year, it's just a $95 or $70 copay. Diagnostic mammograms and colonoscopies. Again, core and choice plan members, this year, 20 or 15% of the cost is what you will likely pay. But next year, no cost for those diagnostic mammograms and colonoscopies. And then finally, outpatient diagnostic procedures. Now, examples of outpatient diagnostic procedures would be things like EKGs, pulmonary function tests, neurological testing like EEGs, or sleep studies. Again, this year, for those services, our core and choice members, 20 or 15% of the cost is your responsibility, but next year, it's just a $25 or $20 copay. So really great changes for these diagnostic, imaging, and X-ray benefits on the core choice plan for next year. Now, on the complete, those services are covered in full this year, and they will continue to be covered in full. So no cost to you for those mentioned services on the complete plan. A couple other things to mention on this slide. First of all, inpatient hospital. The copay for that on the core plan is being reduced next year. It will go down to $300 per day for the first 5 days. After that 5th day, no further responsibility on your part. And then we're also lowering the inpatient hospital copay on our choice plan. That'll go down to just $150. And that $150 is going to cover the entire time that you're in the hospital, whether it's 1 day, 5 days, or 50 days. It's just that one-time $150 copay. Moving into the next slide, we continue with medical benefits. And with this slide, really no significant changes to these benefits from this year moving into next year. Okay, well, the dental benefits. Again, the big change here for dental next year is our choice and complete plan members are going to get that comprehensive dental coverage. But we will also continue to cover preventive on all the plans. So core, choice, and complete, you're going to continue to get that preventive, and that's going to be 2 exams, 2 cleanings, a set of x-rays, and a periodontal cleaning. Now, new for next year, we're also going to include this for all 3 of our West Region Advantage plans would be fluoride treatments. You get up to 2 of those. And the remaining benefits on this slide then would only apply to the choice and complete plans. So fillings, extractions, root canals, periodontics, the implants, bridges, dentures, and crowns, that's all going to be covered. And you can see you would pay 30% of the cost for a filling and 50% of the cost for any of those other mentioned dental benefits. Okay, the drug coverage. So first of all, with all drug plans, there is a formulary, and that's just a list of all the drugs that plan covers. Within the formulary, we categorize all our medications by tier levels, and there's 5 of them. They're listed in the column to the far left. Now, the first 2 tier levels, tiers 1 and 2, those are going to be made up primarily of generic medication. Tiers 3 and 4, you're getting into brand name medications, and Tier 5 is reserved for specialty drugs. Now, on the core plan this year, there is no deductible for just Tier 1 drugs. But next year, we're getting rid of that deductible not only for Tier 1, but also Tier 2 meds, and we're reducing the deductible for Tiers 3 through 5 medications to just $350. On the choice plan, that deductible this year is not there for Tier 1 and Tier 2, but next year, your Tier 1, 2, and Tier 3 medications, there will be no deductible. And here on this plan, again, we are reducing the deductible for Tiers 4 and 5 drugs to $250. The complete plan, there is no deductible for any tier level medication. And this is the plan where our covered insulins are at no cost. Now, another change here, and this is only for the choice and complete plans, is we got rid of those preferred and standard pharmacies. So now whichever pharmacy you go to, it's just one set copay. So no longer do we have, again, those preferred and standard pharmacy options. Well, as I mentioned at the beginning of the presentation, Medicare does have rules that apply to all drug plans in the country. And one of those rules is called the coverage gap, or what you'll commonly hear referred to as the donut hole. Now, how this works is once what you have spent on your medication and what Blue Cross Blue Shield has subsidized, when those two numbers together reach $4,430, you are now in the coverage gap, meaning now you're going to pay 25% of the cost for all covered medications. And you'll keep paying that 25% until what you and you alone have spent on medication reaches $7,050. If you get to that point, you have reached what's called catastrophic coverage. Now you go to paying $395 for covered generics, $9.85 for covered brand name drugs, or 5% of the cost of your medication, whichever one of those numbers is greater. And you'll continue to pay according to this catastrophic coverage schedule until the end of the calendar year, at which point the slate is wiped clean and you start over. Well, some nice extras that come with the Advantage plans. First of all, we'll continue to offer our over-the-counter benefit. And the over-the-counter allowance is going to be for things like vitamins, supplements, could be over-the-counter pain relievers, Band-Aids, bandages, toothpaste, sunscreen, bug spray. These are all examples of over-the-counter items. And our complete plan members will get $50 every quarter towards those items. Our choice and core plan members will get $40. Silver sneakers, we're going to continue to work with Silver sneakers next year, and that's just your gym membership. No cost to be a member at any participating Silver sneakers gym. There's about 17,000 Silver sneakers gyms across the U.S., and you can join any one of them, and there's no limit to the number of gyms you can become a member of. Acupuncture for next year, just like this year, we're going to give you 20 visits for pain. Our vision coverage will continue to offer 2 exams at no cost with some nice reimbursements available for glasses or contacts. All of our West Region Advantage Plan members will get a full annual physical covered in full, and this is going to go above and beyond that wellness check that Medicare offers. We will also cover a hearing exam for all our Advantage Plan members, no cost, and we will continue to ship meals to our members who have had inpatient hospital stays right to their home. Dental, big change here is that we're adding that comprehensive dental to our choice and complete plans. All right, well, the next Advantage plans we'll be discussing are the South Region Advantage plans. And if you direct your attention over to the right of the screen, you'll notice that map of Minnesota. The counties highlighted in blue make up the South Region. So again, you need to reside in one of those highlighted counties in order to be eligible to enroll in these South Region Advantage plans. Now, these South Region plans are regional. We do cover 95% of all the providers in that region. These plans have low monthly premiums starting at just $38.30 a month. And there's 3 different South Region options, all of which include both medical and drug coverage, as well as a lot of nice extras like dental, vision, and hearing. Again, these are only available to South Region residents, and it is a focused regional network. If you do travel outside of Minnesota but within the U.S., we extend coverage to all 50 states. And if you do any international traveling outside of the U.S., we do extend our emergency benefit. Now, these Advantage plans are annual contracts, and that simply means year to year, the benefits can change. Well, we're making some really nice changes, some really nice enhancements to our South Region Advantage plans moving into next year, and want to take a moment to talk about that. So first of all, on the core and choice plans, the drug deductible will be going down next year. The monthly premium on the core plan, that's also going down next year. And the next benefit is a new one. This is something that a lot of our members have been asking for. We are going to be adding comprehensive dental coverage to our choice and complete plans for next year. And in a few slides, I'll go into more detail about how that comprehensive dental is going to work. Also, something we've got some feedback from a number of members is currently our core and choice plans for any radiology services, you're paying a percentage of the cost. But next year, we're going to change that to a set copay structure. Also, really good news, we're going to be adding Allina to the network for next year. This year, it's primarily made up of Mayo, but next year, we're going to be adding the Allina health system to our South Region network. So great changes, great enhancements to these South Region plans moving into 2022. Now, not necessarily changes, but very key features. First of all, that network, Mayo Clinic is going to be included. The Mankato Clinic is going to be included. And again, new for next year, the Allina Health hospitals and providers will be part of the network. We've got about 63,000 pharmacies that participate in our network across the U.S. And this is really important. There are no referrals needed. So if you want to see a specialist or maybe get a second opinion, you do not need to talk to your primary doctor. You can just pick up the phone and make that appointment. So we do make it very easy and convenient for our members to navigate through that South Region network. Now, as I mentioned before, if you travel outside of Minnesota, but within the U.S., you have coverage that extends to all 50 states. And our Advantage Plan members get 9 months every year to travel around the country. If you do leave the country, your emergency benefit goes with you. And although that's a great benefit to take with you outside the country, I do recommend to all my South Region Advantage Plan members, if they're going to be traveling outside the U.S., to look at travel insurance. And we do have a great product at Blue Cross called Geo Blue. If you're interested in getting more information about how that works, feel free to get in touch with us. Okay, well, here we have our 3 South Region Advantage plans, the core, the choice, and the complete. The core plan is $38.30 a month. The choice plan is going to be $125.90 next year, and the complete will be at $191.80. Now, just like this year, next year, there will be no deductible for medical benefits, and the out-of-pocket max on the South plan will be $6,700. We're actually reducing that out-of-pocket exposure next year on our choice plan by $100, so that'll go down to just $3,000 next year. And on the complete plan, that out-of-pocket max will be $2,900. Now, the out-of-pocket max is listed just below those, where it says in and out of network combined. This would be your out-of-pocket max if you get services outside the network. So you still have a benefit when you go outside of our network, but it's not nearly as good as when you stay in the network. So you can see that out-of-pocket exposure a little bit higher when you're out of the network. And speaking of out of network, well, per service, you would pay 45% of the cost when you get those services outside of our network. If you do stay in the network, what kind of copays are you going to be looking at? And we'll address that on this slide. So what we've done here is in the column to the far left, we have added some of the more commonly utilized medical benefits. And then you're simply going to be able to slide over to the right under the 3 Advantage plans and see what kind of copay you would have to take advantage of those services. Now, I won't go through all of these. I just want to highlight the changes that will be occurring moving into next year. So first of all, on the core plan, a specialist visit this year is $50. Next year, we're going to reduce that by $10. So our core plan members, just a $40 copay to see a specialist next year. X-rays. This year, our core and choice plan members are paying either 20 or 15% of the cost for X-rays. Next year, just a $10 copay on the core, and there will be no cost for those X-rays on the choice. Now, examples of what would be considered an X-ray. Let's say you twist your ankle and you go into an orthopedic urgent care to get a picture of that. The image they take, that's going to be considered this X-ray. Outpatient advanced imaging. Examples of what's considered outpatient advanced imaging would be things like a CT scan, an MRI, an ultrasound, or a PET scan. Now, again, this year for those outpatient advanced imaging services, our core and choice plan members are paying either 20 or 15% of the cost, but next year, just a set copay of either $95 or $70. Diagnostic mammograms and colonoscopies, this year, core choice members, 20 or 15%, but next year, no cost for those diagnostic mammograms and colonoscopies. And then finally, outpatient diagnostic procedures. Examples of outpatient diagnostic procedures would be things like EKGs, pulmonary function tests, neurological testing like an EEG, or sleep studies. Right? Those are all examples of outpatient diagnostic procedures. And again, this year, core and choice members paying either 20 or 15% of the cost, but next year, it's just that set copay of either $25 or $20. Now, on our complete plan, members this year, no cost for those mentioned services. Next year, that will continue. So really, on the core and the choice plan, great changes to those diagnostic, imaging, and x-ray benefits moving into 2022. Also, some other good changes I want to take note of. Inpatient hospital on the core plan, the copay will be going down to just $300 per day for the first 5 days. And on the choice plan, we're reducing that inpatient hospital copay to $150. And that's for the entire admittance. Whether that's 1 day, 5 days, or 50 days, you just have that one-time $150 copay. On the next slide, we continue to go through medical benefits, and here, really no significant changes moving from this year to next year on these particular benefits. All right, the dental. Again, big change with dental is that we're adding comprehensive dental benefits to our choice and complete plans. But all the plans for preventive, we're going to continue to cover 2 exams, 2 cleanings, a set of x-rays, and a periodontal cleaning for all our Advantage Plan members at no cost. We are also going to add fluoride treatments. So all of our Advantage Plan members will get 2 fluoride treatments at no cost. The remaining benefits listed will only apply to the choice and complete plans. So here we're talking about fillings, extractions, root canals, periodontics, implants, bridges, dentures, crowns. All of that's going to be covered for our choice and complete plan members. And you can say you would pay 30% of the cost for a filling or 50% of the cost for any of those other mentioned dental benefits. So again, great changes on that choice and complete plan, adding that comprehensive coverage moving into next year. All right, well, the drug coverage for next year. So first of all, we have a formulary, and that's a list of all the drugs that we cover. Now, on that formulary, we categorize all our medications by tier levels. And in the column to the far left, you can see that we have 5 different tier levels for all of our medications. Now, tiers 1 and tier 2 medications are primarily made up of generic drugs. Tiers 3 and 4, you're getting into your brand name medications, and tier 5, that's going to be for specialty drugs. On the core plan, next year, there will be no deductible for both tier 1 and tier 2 medications. And we're actually reducing the deductible on tiers 3 through 5 medications to just $350. On the choice plan, we're getting rid of the deductible next year for tier 3 meds. This year, it's just 1 and 2. Next year on that choice plan, no deductible for tiers 1 through 3 meds. Also, that deductible for tier 4 and 5 meds we're reducing to just $250. And then finally, over on the complete, there will be no deductible for any tier level medication. And remember, this complete plan is the one where our covered insulins are at no cost. Another change to take note of is that we've done away with those preferred and standard pharmacies. Now every pharmacy is the same, have the same copay as long as you're using an in-network pharmacy. The coverage gap or the donut hole is a Medicare rule that does pertain to all drug plans across the country. And how this works is once what you have spent on your medication and what Blue Cross Blue Shield has subsidized, once those 2 numbers together reach $4,430, you are in the coverage gap or the donut hole, meaning now you're going to pay 25% of the cost for all covered medications. Now, you'll keep paying that 25% until what you and you alone have spent on your medication reaches $7,050. If you get to that point, you have reached catastrophic coverage. Now you'll pay $3.95 for covered generics, $9.85 for covered brand name drugs, or 5% of the cost, whichever is greater. And you'll continue to pay according to that schedule until the end of the calendar year, at which time the slate's wiped clean and you start over. All right, well, let's talk about these extras that we include with our Advantage plans. First of all, the over-the-counter allowance. This will apply to things like vitamins, supplements, Band-Aids, bandages, toothpaste. This could be even sunscreen or bug spray. All right, so lots of things covered under this over-the-counter allowance. And our complete plan members will get $50 a quarter towards those items, whereas our choice and core plan members will get $40 every quarter. We're also going to continue to work with Silver Sneakers, and this is your gym membership. So you basically get a free gym membership to any participating Silver Sneakers gym. And there's over 17,000 of those across the country. You can join any one of them, and there is no limit to the number of gyms you can become a member of. Acupuncture will continue to give our members up to 20 visits for pain. Vision, going to continue to give our members 2 vision exams every year. And we'll also continue with those reimbursements for glasses or contacts. The physical exam on all the Advantage plans covered in full, and this exam is going to go above and beyond that wellness check that Medicare offers. We'll also continue to offer our hearing exams on all of our Advantage plans at no cost to our members with really great discounts on hearing aids. And we'll also continue to send meals to our members' homes after they've had inpatient hospital stays. With dental, the big change moving into 2022 is that we're going to include that comprehensive dental coverage on both the choice and complete plan options. Well, next, we're going to talk about our Platinum Blue cost plans. Now, the first thing to be aware of with these Platinum Blue cost plans is that the federal government restricts where insurance companies can offer these. And in Minnesota, there are just 21 counties where we can offer these Platinum Blue cost plans. And on the next slide over to the right, you'll notice 2 maps of Minnesota. The map on top is in blue, going to highlight the 21 counties, again, where the government allows us to offer these Platinum Blue cost plans. So you do need to reside in one of those highlighted counties in order to be eligible to get one of these Platinum Blue plans. Now, the network, if you look to the map below, is statewide and is made up of 97% of all the providers in Minnesota. So you do have a very large statewide network. These Platinum Blue plans offer low monthly premiums. In fact, we have a plan starting at just $25 a month. There's altogether 3 different Platinum Blue options. And these plans are very unique because you can just take the medical portion of a Platinum Blue plan, or if you want to, you can combine medical and drug coverage into one plan, giving you that convenience of having one card, one bill. It's a one package solution. A lot of nice extras are also going to be included with these Platinum Blue plans, like dental, vision, and hearing. Again, you have that huge statewide network. If you travel outside of Minnesota within the U.S., we extend coverage to all 50 states, and you can go see anyone who takes Medicare. Now, if you travel outside the U.S., your emergency benefit is going to go with you. And lastly, these are annual contract plans, which simply means year to year, the benefits can change. Well, speaking of these changes, we are going to be making some nice enhancements to our Platinum Blue plans moving into next year. First of all, on our choice plan, we're moving to a $0 copay for primary care physician visits. Also, diagnostic eye and hearing exams are going to be covered at no cost on all of our Platinum Blue plans. Over-the-counter allowance is going to go to $50 on the choice and the complete. And over-the-counter allowances, these would be for things like vitamins, supplements. This could be things like even toothpaste, sunscreen, and bug spray. So a lot of different items are going to be covered under this over-the-counter allowance. There's going to be a flat copay on select radiology services, where on some of our Platinum Blue plans, you're paying a percentage of the cost this year. We're going to move to a flat copay for next year. We're also on our dental coverage with these Platinum Blue plans going to be including fluoride treatments for next year. Well, not really changes to the Platinum Blue plans, but definitely key features to be aware of. First of all, that network. And that, again, is made up of 97% of all providers in the state. So huge statewide network. We've got about 63,000 pharmacies that are in our network across the U.S. And this is really important as well. There's no referrals needed. So if you want to see a specialist or get a second opinion, you do not need to talk to your primary care physician. You can simply pick up the phone and make that appointment. As I mentioned before, we do extend coverage to all 50 states in the U.S., and you can go see anyone that takes Medicare. And our Platinum Blue members get 9 months to travel around the country. If you leave the country, if you do some international traveling, your emergency coverage goes with you. And while that's a nice benefit to take with you outside the country, I do recommend to all my Platinum Blue members to at least consider looking at travel insurance when you leave the U.S. And we have a great product at Blue Cross called Geo Blue that will extend more coverage than emergency when you do leave the U.S. We won't have time to go into detail on our Geo Blue travel insurance today, but if you're interested, just get in touch with us. We can get you information on how those plans work. Okay, well, here we have our 3 Platinum Blue plans, the Core, Choice, and Complete. Now, the first monthly premium we're going to look at for these plans is just medical. All right, so on the Core plan, just the medical portion, $25 a month, the Choice, $99, and the Complete, $169. Now, if you wanted to add a drug plan to that medical and bundle it together in one plan, well, then look to the second line item from the bottom. You can see on the Core plan, to add that drug coverage, it would be an additional $18.20. So combine that with the $25 you'd be paying for the medical, and you're at $43.20 a month. On that Choice plan, if you want to bundle the drug with the medical, and it's an additional $31.60, which would bring you to $130.60 per month. And over on the Complete, to add that drug coverage, it would be an additional $63.50. Added to the $169 for medical on that Complete, you'd be at $232.50. No deductible for any medical benefits, and the out-of-pocket maxes for your medical on the Core would be $6,000, the Choice $3,500, and over on the Complete, that's just $2,700. All right, well, on the next slide, what we've done is identify some of the more commonly utilized medical benefits. And you can then simply move to the right to see what kind of copays you would have to take advantage of those benefits. Now, I'm not going to go through all of these. I just want to highlight some of the changes. First of all, your primary care visits on the Choice plan next year, that's going to $0. X-rays on that Core plan, this year you'd pay 20% of the cost, but next year that's just going to be a $60 copay. So great change there for our core plan members for those outpatient X-rays. Now, the rest of the benefits listed here, fairly unchanged moving into next year. Now, the first part of this slide on the top, we continue with medical benefits. And again, with these medical benefits, really no significant change to how those will work moving into next year. The dental coverage. So this is going to be a benefit that applies only to the Choice and Complete plans. So first of all, you're going to continue to get your preventive dental covered. 2 exams, 2 cleanings, a set of X-rays, and a periodontal cleaning covered in full. And we're also adding that fluoride treatment. So you get 2 fluoride treatments on the Choice and Complete plans next year, no cost to you. All right, well, the drug coverage, again, this is an option. If you just want to take the medical portion of these Platinum Blue plans, that's fine. But again, if you want the convenience of having your medical and drug combined into one plan, here's how that drug coverage would work. So over on the column to the left, we have 5 different tier levels, and that's how we classify the medications that we cover. So the first 2 tier levels are going to primarily be your generic medications. Tiers 3 and 4, those are primarily made up of your brand name drugs. And then finally, tier 5, these are going to be your specialty medications. Now, on the core plan, you would have a $480 deductible to meet before you drop down into those cost-sharing amounts listed in the chart. On the choice plan, we get rid of that deductible for tiers 1 and tiers 2 medications. If it is a tier 3 through 5, you would have a $480 deductible to meet. And that's going to be the same thing on the complete. The coverage gap or the donut hole. This is a Medicare rule that applies to all drug plans in the country. So these dollar amounts and percentages I'm about to go through do apply to every drug plan in the U.S. Now, how this works is once what you have spent on your medication and what Blue Cross has subsidized, when those two numbers together reach $4,430, you are in the coverage gap. And this means now you're going to be paying 25% of the cost for all covered medications. And you'll keep paying that 25% until what you and you alone have spent on your medication reaches $7,050. If you get to that point, you have reached catastrophic coverage. Now you pay $395 for covered generics, $9.85 for covered brand name drugs, or 5% of the cost, whichever is greater. And you'll continue to pay according to that schedule until the end of the calendar year, at which point the slate is wiped clean and you start over. All right, well, next, let's talk about some of the nice extras that are included with these Platinum Blue plans. First of all, we will continue to work with the Silver Sneakers program. So whichever Platinum Blue plan you decide to enroll in, the monthly premium you pay for that plan is going to cover a gym membership in full as long as that gym participates with Silver Sneakers. And right now, there's about 17,000 participating Silver Sneakers gyms. You can join any one of them, and there's no limit to the number of gyms you can become a member of. Acupuncture, we're going to continue to give you 20 visits for pain. We are also going to continue on all the Platinum Blue plans to cover a physical exam at no cost to you. And this physical that we include with Platinum Blue, that's going to go above and beyond that wellness check that you get from just Medicare. Dental coverage is included on the Choice and Complete plan. And remember, we're adding those 2 fluoride treatments. And then vision. This will also be for just the Choice and Complete plans. You're going to get 2 exams every year, plus nice reimbursements for glasses or contacts. All of our Platinum Blue members are going to get a hearing exam at no cost, as well as take advantage of some of the nice discounts we have for hearing aids. The over-the-counter allowance. Our core plan members will get $25 every quarter, and our Choice and Complete plan members will get $50 every quarter. And again, this would be towards over-the-counter items like vitamins or supplements. All right, the next plans we're going to be covering today are our supplements, or what you'll often hear referred to as Medigap plans. Now, these plans offer some unique features that do set them apart from either the Advantage or Platinum Blue plans that we've already discussed. And I want to go through some of those unique features to start. First of all, the benefits on these Medigap plans are guaranteed to renew. So what that means is as long as you keep paying your monthly premium, you keep the same benefits. The Platinum Blue and Advantage plans are annual contracts, so year-to-year benefits can change. Not the case with these Medigaps. Guarantee issue will be an important concept for you to understand. How this works is you're going to get 6 months from whenever your Part B as in Bravo Medicare starts to enroll in a Medigap plan and have a guarantee issue. That just means you fill out the application and you are accepted, no questions asked. However, in most cases, if you apply for a Medigap plan after that 6-month period, there will be health questions that go along with the application. Now, that means our underwriters are going to look at any pre-existing conditions, and they do have the right to deny you coverage. Now, these plans are available to all Minnesota residents, so they are not regional. So no matter where you live, whatever county you reside in, it's the same plan, same benefits, same monthly premiums. These plans are the only ones that are completely portable. So wherever you go, the plan goes with you. Even if you move permanently to another state outside of Minnesota, you're going to take these plans with you. These can only be medical. All right. So unlike the other plans we talked about where you can bundle the drug, not the case here. Now, that does give you the freedom to choose any standalone Part D drug plan available to you in Minnesota. But important to understand that these Medigap plans are only going to be medical coverage. All right, well, your network on these plans is simply anyone who takes Medicare. Now, that's not just in Minnesota, that's going to be across the entire country. So you do have a very large nationwide network with these Medigap plans. If you do any travel outside of the US, like all the other plans we talked about today, your emergency coverage goes with you. And here again, I would recommend looking at our travel plans, which are called Geo Blue. We do also, will continue to offer the Silver Sneakers gym membership to all of our Medigap plan members. So as long as you're going to a gym that participates with the Silver Sneakers program, by the way, there's about 17,000 of those across the country, then that membership is at no cost to you, and you can join as many gyms as you like. We do have local customer service, a 24-hour-a-day, 7-day-a-week nurse line. Blue 365 is going to offer discounts on health-related items. These might be things like glasses or hearing aids. And then we also have wellness programs and health coaching available for our Medigap members. All right, well, let's look at the rates for these plans moving into next year. And we're going to have two different sets of rates to look at. The first rates we're going to look at are going to apply to those Medicare beneficiaries whose Part A eligibility for Medicare occurred before January 1st of 2020. All right. The next rates we're going to look at are going to apply to those Medicare beneficiaries whose Part A Medicare eligibility occurred on or after January 1st of 2020. Now, why is this? Why do we have two different rates, and why is this January 1st of 2020 a pivotal date? And it all boils down to federal legislation. So there was federal legislation that changed the way all insurance companies across the country can offer these Medigap plans. And that's why we've got two rates. So let's look at the rates in 2022. We do have the 2021 rates up there for your convenience. When we have two rates here on this slide, the tobacco-free rate is self-explanatory. The standard rate would apply if you've used tobacco in the last 24 months. So our high deductible plan next year, tobacco-free, $82.15 a month. Plan N is going to be $189.60, seeing a reduction on that one. The basic Medicare Blue plan will be $262.90. And finally, Senior Gold will be $289.65. Now, under Basic and Senior Gold, you'll notice it says with 4 riders. Now, riders give you more coverage, and they come at an additional cost. The vast majority of both our Basic and Senior Gold members take those plans with all 4 riders, giving them the most comprehensive plan, right? And those rates we just talked about, again, they do include all 4 of those riders. All right, the next slide, we want to talk about the rates that apply to those folks whose Part A Medicare eligibility occurred on or after January 1st of 2020. The high deductible plan, tobacco-free, $64.65 next year. Plan N, $189.60. The basic Medicare Blue plan, $245.40. And finally, Senior Gold will be $272.15. Now, note under Basic and Senior Gold, now we're just saying with 3 riders, right? And that's part of that federal legislation. We can only offer those plans with 3 riders, right? And that's why, in large part, the monthly premiums on this slide are a little bit less than what they were on the last one. All right, well, let's talk about benefit structure. We've already gone through the monthly premiums. Let's talk about how this high deductible plan is going to work. So not too surprisingly, there is a deductible. Now it's $2,370. That's what it is this year. Medicare actually sets that deductible. And again, they have not yet released their 2022 plan information. So that could change moving into next year. It is set by Medicare. But this year, our high deductible members will pay the first $2,370 for any covered benefit cost. After that deductible is met, as long as it is a Medicare eligible service, there is no further cost. Plan N, I like to call this one the copay plan. Now, first of all, you are going to have a deductible for any services you get outside the hospital. This year it's $203. Again, this is a number Medicare sets. Haven't released what that'll look like for next year yet, so that could change. But after that deductible is satisfied on Plan N, there are ongoing copays for 3 different benefit categories, and I'll show you those on the next slide. And then finally, we have the basic Medicare Blue plan. On this plan, like Plan N, you'll be responsible for meeting Medicare's Part B deductible. But on the basic plan, after that deductible is satisfied, there are no further costs for Medicare eligible services. Now, on the next slide, we identify some of the more commonly utilized medical benefits. But really, we know how these plans work. So that high deductible plan, you meet that high deductible, this year $2,370. After it's met, there's no further cost for covered benefits. Plan N, what I like to call again the copay plan, after Medicare's Part B as in Bravo outpatient deductible is met, you will have ongoing copays for office visits at $20, emergency services at $50, and urgent care at $20. And then finally, on that basic Medicare Blue, again, once Medicare's Part B as in Bravo deductible is satisfied, there will be no further costs for eligible Medicare services. Now, I do want to go back up here to the second line item from the top where it says preventive benefit. Important for you to remember on all these Medigap plans, Medicare is your primary insurance. So all claims are going to go to Medicare first. And for the most part, if Medicare doesn't cover a service, neither do these plans. So remember back to the beginning of the presentation when we talked about some preventive benefits Medicare doesn't cover. For example, a vision exam. Now, on the high deductible in Plan N, because Medicare doesn't cover it, neither do these plans. The basic plan, though, you get $120 every year towards any preventive services Medicare does not cover. So a little extra benefit for those preventive services on the basic plan. All right, well, the next and final plans that we'll be discussing today are our Medicare Blue RX prescription drug plans. Now, remember, if you have an Advantage plan, you already have drug coverage. If you have a Platinum Blue plan, you might have decided to bundle a drug plan with the medical. But if you have one of those Medigap plans we just looked at, that doesn't come with drug coverage, so you'll definitely want to consider one of our standalone drug plans. And we have 2 for next year, the Standard and the Premier. The Standard plan will be $82.80 next year, the Premier $116.10. Now, on the Standard plan, there will be no deductible for Tier 1 and Tier 2 medications. Tiers 3 through 5 medications will have a $480 deductible. On the Premier plan, there will be no deductible for any tier level medication. You can see with these plans, we will continue with that preferred and standard pharmacy setup. All right, as I mentioned at the beginning of the presentation, Medicare does have rules that apply to all drug plans. And one of those rules is called the coverage gap or the donut hole. Now, these dollar amounts and percentages I'm about to talk about do apply to all drug plans in the country. So here's how this works. Once what you have spent on your medication and what Blue Cross Blue Shield has subsidized, when those two numbers together reach $4,430, you are now in the coverage gap. That means now you're going to go to paying 25% of the cost for all covered medications. And you'll keep paying that 25% until what you and you alone have spent on your drugs reaches $7,050. If you get to that point, you have reached catastrophic coverage. Now you'll be paying $3.95 for covered generics, $9.85 for covered brand name drugs, or 5% of the cost, whichever number is greater. And you'll continue to pay according to this catastrophic schedule until the end of the calendar year, at which time the slate is wiped clean and you start over. Now, there's one exception to this coverage gap rule, and it's on our Premier plan. On that Premier drug plan, if you get into the coverage gap, then any Tier 1 or Tier 2 drug filled at one of our preferred pharmacies will be at no cost, as opposed to having to pay 25% of the cost like you would on any of the other drug plans that we've looked at today. All right, well, let's talk about the Part D late enrollment penalty. So If you do not take a Part D drug plan when you are first eligible, and then later down the road decide to pick up a Part D drug plan, Medicare is going to penalize you. Now, the penalty is going to be 1% of the national average cost of a Part D drug plan. Now, this year in 2021, that's somewhere around $35 a month. So 1% of $35 is 35 cents, but then you're going to multiply that 35 cents by the number of months you could have had a drug plan, but you didn't. So the longer you go without a drug plan, the higher that penalty potentially becomes. But whatever it calculates out to be, you will be paying every month on top of the cost of whatever drug plan you enroll in. And that penalty is going to remain in effect as long as you have a Part D drug plan. So important to know how that works and that will continue into next year. Well, medications can be very expensive. There is extra help available. And to find out if you qualify or to just get more information about these extra help programs, you can contact Social Security or Medicare. And I've got those numbers listed for you on this slide. What to expect when you enroll. I won't go into too much detail here. If you do enroll, I'm sure your agent or Blue Cross representative will take you through this, but you can expect an ID card. You can expect an invoice, a bill. There'll be a welcome kit and a number of other things that come with that. I'm also required to show you by Medicare some of the information about Blue Cross Blue Shield, including these addresses. And I am also required to put this slide up for you about important information. Again, it's a Medicare requirement. If anyone would like a copy of these slides or more information, you can feel free to contact your agent or Blue Cross. Thank you for attending. That's all we've got for you today.
Thank you for tuning into this annual Notice of Change video. We appreciate your membership with Blue Cross and hope you found this video helpful and informative. If you have questions, please don't hesitate to reach out to our team at the Roseville Center. One last reminder, if you know anyone who is considering Blue Cross for their Medicare plan, you're welcome to share our contact information. We'd be happy to help. Thanks again, and take care.